This is my mother, Kim. Mom, say hi.
Hi.
She's getting ready to head off to her second job. During the day, she works as a surgical tech in the prenatal unit, delivering little babies, and she's pretty amazing. And I'm here today to talk to you about something really serious that I hold close to my heart, something that I really believe strongly in because I've seen it and I've been a witness to what treatment methadone can do for a person when used correctly and when they are really trying to change their lives and be better. Now, you just met my mother, and she does not look like a junkie or someone who used heroin or someone who used to pop 50 Vicodin a day. But that was my mom, and it was killing her. And she thankfully found the methadone clinic and got clean and has been clean going on 5 years. She has graduated from the surgical tech program. She has dealt with the passing of my brother, of her mother, of her dog. And she has not gone into withdrawals or gone back to taking pain medicine. She has stuck with the methadone and used it in the correct way, the way it's supposed to be used. And she has become the most wonderful, amazing person you would ever know. Before the methadone, I didn't have a mom. Now I do. So, more than anyone else, I have a testimony as to what methadone can do for somebody and how it can turn a person into being nothing and make them the most wonderful person there is. Now, methadone is used to treat people who are addicted to heroin or opiates. Now, opiates are hydrocodone, Vicodin, Lortab, Lorcet, Norcos, anything of that category, that's an opiate. Oxycontin, same thing. It's an opiate. These are highly prescribed medications for when you have toothaches, Band-Aid surgeries, big surgeries. Doctors will prescribe these medications commonly to people to treat pain. What they do not count on is that these people are going to go back and they may be taking these medications anywhere from a month to 3 months, depending on their condition and what they're going through. And it only takes the body 2 weeks to become addicted to a narcotic. So if you are taking a pill every single day for 3 months, your body, your brain, everything is becoming dependent on that medication, which is what happened to my mother after she had to undergo surgery and she was having a lot of pain issues. A doctor prescribed her this pain medication, and it caused her to become addicted to the medication. A lot of people believe that people that are on methadone are still junkies. It's just their way of, okay, well, I'm not going to use pills anymore, or I'm not going to use heroin anymore, but now I've got this drug methadone, and I'm going to use it. And that's what people don't understand. Methadone does not get you high. There is no euphoric effect. It takes away the feeling of opiates. Yes, you can take opiates while taking methadone, but you will not have any kind of feeling. You won't get any kind of feeling because the methadone blocks it. It goes in there where the heroin or the pills normally are in your brain, and it takes that spot over so the pills can't get in there. So it defeats the purpose. And there is some bad side effects of methadone, what I like to call the dome zone. You know, before your medication becomes adjusted and you're on the right dose, you can fall asleep. And my mom would fall asleep on the toilet, and she would fall asleep behind the wheel and at the computer desk and at the chair. And it used to scare me and my sister half to death. That's the worst thing I could say about methadone. Through time and getting her dose correct, she never does that anymore. She never falls asleep anywhere. And I can personally say there are no bad side effects of methadone. It really has worked for my mother. And I don't know if it's because she wanted it to work or if she's just that amazing. But she is definitely an exception, and methadone definitely worked for her. And I would suggest to anybody that is having problems with pain pill addiction or heroin addiction and you really want to change in your life, go talk to somebody at the methadone clinic. Go do your research online and really find out, about this medication, if it could work for you. This is a medication that's been around for hundreds of years. It is one of the most highly researched medications there is out there. There's so much information on this drug. And if people would actually look into it and read up on it, then they would realize that there's a reason that this drug has been around for as long as it's been around, because it's successful and it works. And if you want to help somebody, I highly suggest you get them help through the Methadone clinic, and it will work. That's it.
Very good. How long did it have to be?